Pharma face-off: Azithromycin versus Amoxicillin. Which one is better for your patient? Hello and welcome to Pharma Pro Mastery Hub, your go-to place for mastering pharmaceutical world. I am pharmacist Regina, and in today's Pharma face-off, we will be putting two of the most prescribed antibiotics in the spotlight: Azithromycin versus Amoxicillin. What set them apart? When should one be used over the other? Let's dive into clinical comparison that every pharmacist needs to master. So let's begin with the basics. Amoxicillin is a beta-lactam antibiotics in the penicillin class. It inhibits bacterial cell wall synthesis by binding to penicillin-binding proteins, leading to bacterial lysis. Azithromycin, on the other hand, is a macrolide antibiotics that binds to the 50S ribosomal subunit, inhibiting bacterial protein synthesis. It's bacteriostatic but can be bactericidal at high concentration. Spectrum of activity: Amoxicillin has good activity against Streptococcus pneumonia, Enterococcus faecalis, Helicobacter pylori, and it has limited gram-negative activity on organisms like E. coli and H. influenza. For amoxicillin, it covers atypical pathogens like Mycoplasma, Chlamydia, and Legionella. It also covers some gram-positive cocci, and it also has effect against H. influenza and Moraxella catarrhalis. Clinical indication: amoxicillin is typically used for otitis media, strep pharyngitis, dental abscess, and in H. pylori eradication therapy as part of the combo therapy. Azithromycin is used for community-acquired pneumonia, chlamydia and gonorrhea infections, sinusitis or bronchitis, especially in penicillin allergic patients, and it also used in travelers' diarrhea. Dosing and duration: amoxicillin 250 mg to 500 mg every 8 hours, duration 7 to 10 days depending on the infection. For azithromycin, 250 mg to 500 mg daily, duration 3 to 5 days. For some cases, for some STIs, you can do 1000 mg as a single dose. So remember, the dosage and duration depends on the type or severity of the infection. If you're not a pharmacist watching this, ensure you get clear directions from a pharmacist. Azithromycin's long half-life gives it a huge advantage in patient compliance. Now, in penicillin allergic patients, azithromycin is a useful alternative for respiratory tract infection. Azithromycin is ideal for typical respiratory pathogens, while amoxicillin is ideal for classical ear, nose and throat and dental infections. Safety profile and side effects: for azithromycin, there's chance of QT prolongation risks, so it must be used with caution in patients who have cardiac disease. It can cause gastrointestinal disturbance, and in rare cases it can cause liver enzyme elevation. For amoxicillin, there's allergic reactions like rash, anaphylaxis in penicillin allergic patients. Diarrhea can also occur, especially when combined with clavulanic acid, and there's a risk of resistance. So both antibiotics are important, but understanding their differences help you to optimize therapy, reduce resistance, and improve patient outcomes. Important note to healthcare professionals: as pharmacists, always review drug interaction, particularly macrolides, QT prolongation risks. Always educate the patient on antibiotics adherence and stress the importance of completing the full course. This is to avoid antimicrobial resistance. So like this video if it helped sharpen your clinical edge, and comment below with which drug you've used more often and why. So until next time, keep mastering the medications. Thank you.